welcome to Love Heals Cancer and ZenOnco.io. I'm Asta from ZenOnco.io. This is our cancer healing journey talks where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CHJs are very close to our hearts because many patients tell us that when we listen to other people's journeys, it inspires them, it helps them boost their confidence, and gives them a lot of hope and positivity. So, thank you so much for joining us today for the Cancer Healing Journey talks. And could you introduce yourself and tell us how your journey began?
Hi, I'm Dr. Samrakshni. First of all, thanks to Janonco for having me. Out of the three columns you said, I tick all of them. I am a caregiver, I am a doctor, I am also a survivor. Uh, so that is how it is. So coming to my cancer journey, I was diagnosed at 29 years of age with breast cancer. My journey is not a conventional cancer journey because I didn't have any symptoms. I I was diagnosed in a screening scan. What do you call as a annual scans we do if we know we are at high risk, and then I was diagnosed in a screening scan. So it's a different way of diagnosis compared to like how people get diagnosed usually.
Right. Very true. Usually, people
Uh,
face any side effects or symptoms, and then they go for
Symptoms. Yeah, people
tests
do
and all.
get symptoms and then they go to the doctor and then they get diagnosed. But then I came to know that I'm at high risk of cancer like few years before I got diagnosed. And then I was under regular scans, I was under surveillance. So on a regular scan, I was diagnosed while my tumor was very small. It was like 8 mm. 8 mm is less than the size of a pea. Even my surgeon could not, palpate. Palpation is something where we can touch and feel the tumor. So even my surgeon could not feel the tumor. But then I was luckily undergoing this scan. So that is how it got diagnosed.
Right. So, like, I wanted to ask, what all treatments did you undergo?
See, though it was a very small tumor and I didn't have any symptoms, but then owing to the younger age group, my tumor was very aggressive. There's a scoring in this breast cancer tumors, which is called Ki-67, which was very high for me. It was 85% for me, which is very, very high. It was very aggressive tumor. But so that's why I had to undergo surgery followed by chemotherapy and then radiotherapy. And because I was unmarried, and then I might plan for children in future, so my oncologist suggested me to preserve my egg. So after my surgery, I had 3 weeks of gap. So during that time, I underwent ovarian stimulation, and then I preserved my oocyte, which is also called egg, during that time. And then post that, I underwent chemotherapy because chemotherapy damages your ovarian reserve. So according to their advice, I had followed that. And post that, I underwent 4 cycles of chemotherapy and radiotherapy as well.
Right. So, like, I wanted to ask, many times, no matter how much we tell that, we will always stay positive and, we won't take that much of stress or tension. There is always, some time that, we, often, get so much of tension or stress. So, like, how did you manage your emotional well-being?
See, before I was diagnosed, 2 years before my diagnosis, my elder sister was diagnosed. She was actually 31 at that age, and I was 27, I think. I was 27 at that time. And then that was like a very big shock for us because though we had a gene, we have been carrying a gene, but we didn't have a significant family history because before, like in the previous generation, there were no females in my dad's family. He did not have sisters. So that gene did not get expressed in the previous generation, obviously. So we never know that we have been carrying a, very high risk genes. And then my sister got diagnosed when she was 31, and that was the time I got the highest amount of panic of my life because we don't expect people to get diagnosed with cancer at the age of 31. And then at that time, we did a lot of research. We took a lot of opinions, and then we started her treatment. Once we started her treatment, we have calmed down a little. And then I had a period of around 1.5 to 2 years during which I was undergoing scans. So I was somehow mentally, strong to deal with all these things because I have already dealt with my sister's treatment, right? Because I was the point of contact for the doctors and my family, because I had to explain the treatment to my family. I had to take care of my family's emotional well-being, even my sisters and my parents. So breaking down the news to my sister. So I dealt with all these things in the past 2 years. So some way I was little, you can say I was prepared, or maybe I was little stronger to deal with that. So in that way, my treatment was not that emotionally damaging for me as it was my sister's treatment.
Right, right. Very
Because
true.
it was like I knew the drill. Once I got diagnosed, I knew the drill somehow, because and now I have to go to the medical oncologist. Now I have to go through the surgery. Yeah,
Right, right. Very true. Totally agree with you. And in fact, it
yeah,
is
but
so
then
much important to, remain strong and, positive.
right, and but then the support of family was very important. Like because two young girls in the family getting diagnosed by cancer within a span of 2 to 3 years is not easy to deal with, especially for the parents and my younger brother. They have been a very big support to us. Like obviously they felt broken, they felt all the pain, but then they never showed that pain to us. So that is how it was.
Right, right. Totally agree. And as you just mentioned that, you have been a caregiver as well and you're already a warrior. So, I wanted to ask, what message would you like to give to cancer patients as well as cancer caregivers?
Uh, See, most of the time I see people denying their treatment. Most of the times they think we don't want to undergo this treatment because it might have multiple side effects and all. First of all, you just have to sit down, take multiple opinions, finally understand your treatment and start the right treatment at the right time. You can't keep on postponing your treatment, because at the later stage it will be very difficult to treat that cancer. Any cancer diagnosed early stage has got very good prognosis. For suppose in breast cancer, if it is diagnosed in stage one, 5 year survival rate is around 99%, which is very, very good. So, and going from stage one to stage three or four doesn't take much time in younger age group. It grows very fast in younger age group. So, I only suggest to believe in the doctor. And then when the doctor suggests, yeah, it's always good to take a second opinion. And if you are not satisfied, take a third opinion also. There's nothing wrong with it. But then start your treatment on time. Be positive about your treatment and know what all the side effects you're going to get. You obviously cannot avoid all the side effects of cancer treatment. There are multiple side effects. Just know your side effects, keep in contact with your doctor, and take whatever like good diet you're advised, and try to be active, try to communicate with people. People get depressed and then they stop talking to everyone, and it keeps that vicious cycle in their brain going. So try to cut it off. That's how I used to do. I used to talk to my friends. I used to connect with the other cancer warriors, because their perspective sometimes they used to inspire me. So I used to talk to a lot of people, and then I restarted my childhood hobby also, because being a doctor, I would not get a lot of time to do all these things. So when I was diagnosed, I was sitting at home. So I restarted doing painting, scribbling, and everything. And I used to get time for meditation. Though I used to do yoga previously, but then I was not able to do yoga during chemotherapy. But then I continued doing meditation. So I think these are the things I would like to tell to people who are undergoing cancer treatment. And coming to the caregivers, like caregivers have the toughest job actually, because they have to take care of themselves. before they take care of the cancer patients. And then just be positive with them. Sometimes I would suggest let them be real about everything, because you need not sugarcoat things. It's different if you're dealing with children, but if you're dealing with adults, you just say whatever is told to you by the doctor, and then just have a positive outlook.
Right, right. Thank you so much for giving such a wonderful message to both the cancer patients and caregivers, right? And yeah, so I would again like to thank you so much for, sharing your journey with us, sharing your learnings with us, and specifically the things that you told about, emotional wellness and, how to handle things and, the message that you gave. So thank you so much once again. And I'm sure that this would help so many of, cancer patients and caregivers out there.
Thank you, Asta. Thank you for having me.
Right. Yeah, thank you so much.